total knee replacement is hugely successful, but we are stuck with a group of patients who don't quite do as well as we think they either ought to do or possibly could do.
We have approximately 10 to 20% reported dissatisfaction rates with total knee replacement. Roughly half will report anterior knee pain or tightness across the front of the knee.
So obviously our challenge is balancing this third space, and right now we don't really have a way of doing it. We're kind of guessing.
So many surgeons understand that anterior compartment is important, and we'll talk about changing the flexion or the size or the position of the femoral component. But actually, once you have fixed that femoral component position, most people wouldn't dream of going back and recutting or refining that position. So it becomes that the patella is the area where we can change or redistribute those forces. So it's a three-dimensional problem and therefore very hard to quantify.
What Quadsense is trying to solve for us is a better balance, a better management of the pressures of the patellofemoral joint, with the ultimate aim of improving patient outcomes and reducing patients' discomfort and the tight feeling many patients feel after knee arthroplasty.
My early experience with Quadsense is quite surprising. And although I'm very careful with my measured trochlear resection, I'm careful with my measured patellar resection, what Quadsense told me was I was regularly overstuffing the third space, regularly overstuffing the patellofemoral joint, regularly having too much pressure in the patellofemoral joint. So actually it's altered my approach to patellar resection now, and I realize how important that is to get right.
Quadsense allows us to measure the pressure between the patella and the femur intraoperatively during the process of a knee replacement. And that gives us an idea of where we go next in terms of cutting the patella.
Initially, we weren't sure what we were going to expect when we started measuring with Quadsense. And what has surprised us, and it's been quite gratifying, is that it's very reproducible, it's very consistent. And so that data became quite easy to interpret, more easy than I thought it would be. Quadsense for me gives us a way of putting a figure on the load we're putting through the patellofemoral joint. It tells me what I've done as I approach the knee surgery, but then it also tells me how to get it right. Quadsense allows me to put a figure on that and guides me in the surgery where previously I didn't have a guide.
So Quadsense is a highly efficient use of time. For those of us who resurface patellas routinely, this is adding about 15 to 30 seconds. I mean, it really is phenomenally quick. And using the Quadsense jig has been kind of a revelation for me in that I've gone back to using that to do my patella cuts. It's easy, it's repeatable, and it gives me a good, accurate cut.
What's very gratifying is you can see directly the effect of doing that, and it's a very powerful way of changing the patellofemoral pressures.
You have to be wanting to try and improve your knee replacements.
It will work with any implant system, and it can be used by any knee surgeon.
It just fits in the workflow without really any difficulty at all.
It's allowed me to have much more confidence in resurfacing the patella. It certainly made me think much more about the patellofemoral joint, but does give us very valuable information that hopefully avoids us closing up a knee with very high patellofemoral pressures, which potentially leads to an unhappy patient.